ladies and gentlemen. As mentioned, my name is Mark Mitchell. I'm one of the business unit managers for Sanofi South Africa, which is a global pharmaceutical player. One of my responsibilities is to look for creative and innovative solutions to handling the huge epidemic that we've got in the country, which is namely mental health. And two of the issues I'd just like to quickly touch on. The one is the name. Mental health, I think, is a challenge and an issue on itself. If you're at a local dinner or a braai, you don't mind discussing your diabetes or your cardiovascular disease, but not many people own up to having some form of mental health disease. So I think that's the first challenge. The second challenge is South Africa. We've got a huge epidemic in tuberculosis and in HIV, which most of the time gets the headlines and the front pages. And very unfortunately, we needed something like Life Esidimeni to bring mental health to the forefront, and you all know what tragically happened there. And with that, obviously, mental health has taken a back seat. If you look at the statistics, 1 in 3 South Africans have got some form of mental health disorder, and that covers depression, anxiety, schizophrenia, epilepsy, insomnia. These all fall under the banner of mental health. Of that, 70% of patients are undiagnosed, and 70% of those are untreated. So being a global healthcare player like Sanofi, our main objective is not always to be creative and to find innovative solutions. That's not our being. So we're very dependent and very grateful to have the opportunity to have the 3 startups today to come present possible solutions and partnerships going forward. Thank you.
Yes. Thank you very much, Mark. I couldn't have said it better myself, and that's exactly the key issues we're addressing here today. Without further ado, can we welcome Psyched Pocket Couch and Kenya Health, please? There you go, bud. Kaya Health. All right. Click. 3 minutes on the... Okay.
Between 25% and 33% of people suffer from mental health issues, with 75% of them never getting any help in their lifetime. I personally went through a challenge where I needed to talk to someone, and I didn't know where to go, and I found out how expensive it was, and that's how Psyched was born. My name is Wandile Khumalo, and I'm the founder of Psyched, and we're an online mental health company that focuses on mental health. Currently, the student market is faced with a big stigma of being seen to going out to counseling units to get help, and over and above that, they're faced with long waiting times purely because of the shortage of support staff, where you find that there's 6 therapists that are looking after 30,000 students, and over and above that, there's a huge lack of awareness, and as a result, you find that students end up finding their own coping mechanisms, such as sex, drugs, and alcohol. And should a student feel that they want to go out and get help, they're faced with exorbitant costs that they can't handle on their own, ranging from 700 to 1,400 Rand per session. So our solution is online therapy in the comfort of your home. It's private, it's secure, it's affordable, and over and above that, we create awareness campaigns weekly on topics that students struggle with to help them go through their stresses. How our solution basically works is that there's a screening assessment that they go through, and once they're done with that, we link them up with suitably qualified therapists that can help them with their problems, and then they go on to the online consultation. The market size, currently we have 1 million higher education students, and with the new BEE code stating that corporates have to spend 2.5% of their annual salary bill on higher education, it gives us an addressable market of 350,000 students and a market value of 420 million in South Africa. Our business model is a subscription model where corporates pay a monthly fee, and there's also a pay-as-you-go option, and we charge 30%. Our current traction in the last 3 weeks, we're in the process of signing an MOU with 2 universities, and that gives us access to 90,000 students. And we've already got 2 corporates that have committed to support 750 sessions during the stressful time of exams for students. And we've got partnerships with Vula Mobile and Akiso, which is the largest private psychiatric hospital in the country, and they're basically going to work with us to give us 24-hour support and over and above that, emergency assistance. And this is our team. I'm Wandile with a marketing and IT networking background. We've got an industry expert who's a clinical psychologist, and we've got our CFO who's got experience in investments. So if you'd like to be a part of this and help us tackle this epidemic, please come talk to us. Thank you.
All right, fantastic. Thank you so much. Jerry, can we have some questions, please?
So if I understand well, your solution allows to transfer treatment from online to offline and from offline to online and to make and the reason for that is because of the cost and the availability of the doctors, right?
That's correct. So basically the students would come online and then they would have a private session or on video with therapists.
How efficient is it to go online for this type of discussion and diagnosis?
It's very efficient. Surprisingly, what we found is that students are open to starting off and texting to start off with what issue that they have. And then over and above that, when they have the video session with a therapist, it works really well. And if a therapist picks up that they need face-to-face intervention, that's why we've partnered with the universities, because then we refer back to the university where they then have the traditional face-to-face.
And my second question is the corporates. You announced two corporate partnerships.
Yes.
I understand your business model is a B2C. How do the corporates play here?
So basically in South Africa, because corporates have to spend on higher education, with the bursaries that they provide, it's just an added service that they'll give to their students so that students can have sessions on our platform. And then in terms of our cohorts, we can give reports in terms of what students are suffering with, so we're able to give them additional assistance, whether it be financial literacy or whatever it may be.
Okay, do you see some difficulties you will have to cope with, the main ones you're going to have to cope with to grow your company?
Sorry?
What are the biggest difficulties you may face for growing your enterprise, your company?
That's why we decided to pivot on the student market, because already with the long waiting periods that they have, we're going to come in and help them with the smaller cases that don't necessarily require the clinical psychologists, and we can now, because we have registered counselors and counseling psychologists, so we're working in partnership with them, and that will give us the numbers.
All right, one last question from our panel.
You mentioned, thank you for the pitch, you mentioned therapists. What specialities are you looking at and how many have you signed up?
Okay, so basically we're starting from social workers right up to clinical psychologists, and right now we've signed up 10, and we've got some that are on the waiting list, and we've done that because we want to keep the traffic that's coming through manageable with the numbers that we have, so we don't have people that are waiting.
All right, thank you so much. Next up, the Pocket Couch. 3 minutes on the clock. Take it away.
It's 3 a.m. and I'm typing away furiously at my Lenovo ThinkPad. I'm working for a top-tier management consultancy, and I've been working 16 to 18-hour days. Some would call it a sweatshop for young, ambitious capitalists. I stopped, closed my laptop, and realized I was burnt out, grossly anxious, and I was not clear on where to go. The Pocket Couch seeks to become the first Pan-African e-counseling platform that connects patients with their therapists quickly, efficiently, and affordably. We see three main factors exacerbating the mental health care crisis. One is the undersupply of psychosocial providers across the world, specifically in the African continent. In South Africa alone, there are 0.58 psychosocial providers per 100,000 population. In Ghana, the situation is more dire, with 0.1 psychosocial providers existing per 100,000 population. 2, stigma and taboo. 25 years ago, I wouldn't be able to stand in front of you and tell you that I have struggled with anxiety and depression myself. Yes, I have. And some people in this room will probably have struggled with the same issues too, but you and I would be none the wiser. The Pocket Couch seeks to destigmatize mental health care issues and make sure that we can talk openly about them. Other industries have been disrupted, like the education sector, and we don't think mental health care should be any different. And 3, affordability. It costs, on average, 850 to 1,200 rand per hour to see a psychologist in South Africa. The average worker in South Africa earns 20,000 rand per month. At spending 4 to 6 sessions, 6,000 rand on therapy, spending that proportion of your take-home pay is simply unrealistic. Through the Pocket Couch, we'll provide a subscription-based model that allows patients to connect with their therapists through message, text, and online live video session. Because we're catering to such a diverse market, we'll have varying subscription plans, pay-as-you-go, and contract-based subscriptions. We estimate that there's a market opportunity of about 11 billion rand per annum if Pocket Couch succeeds in capturing at least 5% of the sub-Saharan African market. I'm with my incredible team today. See, now this issue is a global issue, but our initial focus will be on the Pan-African context because of the dire need for psychiatrists and psychosocial providers. My team has a combined experience of 20 years clinical experience, 15 years of strategy and managerial experience, and 10 years of entrepreneurial experience. A business we co-founded was recently nominated for a SAVCA award in the SME category. So, if you want to join us today in democratizing access to mental health care. Thank you.
All right, thank you so much. Can we have some questions from our distinguished jury?
Thank you very much. Where do you stand on your life cycle?
Okay, so we're in the validation phase. We have built a very basic alpha version of the website, and in the last 3 weeks, we've gotten just under 100 individual early signups.
Okay, so what is the next phase for your development?
So the next phase for our development is to actually build the platform. We've already engaged with critical stakeholders, including the Department of Health and one of South Africa's biggest medical funders.
Okay.
How do you differentiate with the competition that would be playing in the same ground?
Yeah. So I think we see two different groups of competition. The one is traditional competitors, so other online counseling platforms. Currently, the two biggest ones in the world are BetterHelp and Talkspace. However, we believe that we have a competitive advantage being boots on the ground. Therapy is a very nuanced and very personalized issue, and we think that having access to psychosocial providers who speak your language, who understand your cultural context, is incredibly important for the success of your therapy journey.
So how are you going to create the supply? How are you going to attract therapists into your platform to be local in all of these countries?
Right. So we, 3 years ago, we founded a medical company, a medical center. So our idea is to leverage our GP practice network in order to have GPs refer to psychologists on the platform. We already have a partnership with the medical center, MediWell Dainfern. They have 6 GPs and they're seeing over 1,200 patients per month. So we believe that there will be a good feeder in order to attract the supply.
Thank you very much.
Thank you.
All right, wonderful. Thank you. Last but not least, Kaya Health. 3 minutes on the clock. Take it away.
My name is Zanele Sajwayo. I am the CEO and founder of Kaya Health. We're a tech-enabled B2B platform, and we're fixing mental health, starting with one of South Africa's most powerful change agents, the corporate. I'd like to introduce you to Melo. Melo is my daughter. Shortly after Melo was born, I joined a Mummy and Me group that was focused on new working moms. I quickly realized after joining the group that actually a lot of moms are struggling to get back to their old selves. A lot of them were anxious about getting back to work, but very few felt that their workplaces provided the psychological safety they needed to discuss their problems openly with their employer. But then I also quickly realized that actually this problem isn't unique to just new mothers. A lot of people in South African workplaces are struggling with mental health and behavioral issues, and the statistics are staggering. 1 in 4 employees is struggling with some sort of behavioral issue: stress, burnout, anxiety, depression, and yet only 15% of those people are accessing the care they need. So what are the issues? Why are people accessing the support they need? And on an employee side, it's actually fairly simple. It boils down to what we're calling the A, B, C issues. A, access, B, budget, and C, confidentiality. But the corporates are feeling the pain too, and it's hitting them where it hurts most, their bottom line. So they're seeing rising staff management costs that are driven up by absenteeism, presenteeism, and increased medical aid claims. More importantly, they have no visibility on their current spend on employee wellness. So we know on average in South Africa, the corporates are spending up to 7% of their total budgets on employee wellness, but they have absolutely no visibility on what the current return on investment on that spend is. And finally, and we all know this, right? Unhappy employees leave, and it's very expensive to replace them. So this is why we exist. We're basically connecting employers and employees with readily available, affordable, clinically effective, and outcomes-focused mental health support. And how we work is very simple. You access our platform, you complete an online mental health support, an online assessment. You're then matched using our unique algorithms with a provider. An appointment is then made. When it's time for your appointment, you have a live video session, and that can be done either via audio, video, or voice. And then finally, and this is the critical part for employers, every quarter we send them with anonymized clinical data on how their staff is performing, but more importantly, how they're progressing. Our business model is also fairly simple. We're a SaaS model, so essentially people pay us to access the platform. And we have two key revenue drivers. We have partnerships and we have providers. We partner up with employers, insurance providers, and also benefit resellers, and also providers pay to access our platform. We're building Africa's largest corporate mental health platform, and we want you to join us. We are very well experienced. We've all worked for Goldman Sachs, we work for Payne & Company, we work for PwC, and we just can't wait to get this started, and we invite you to join us as well. So thank you.
Very well. Thank you, Kaya Health. Some questions from our judges.
To your experience, what is the readiness of corporates to be aware and to accept that some of their employees may complain about their health, mental health situation, because it's risky for a corporate. Then afterwards, the employee attack them due to lack of care within the company. So what's your view about that?
Yeah, absolutely. Look, I mean, I think initially we always thought that, corporates do not want to talk about human resources, and certainly they don't want to talk about the emotions of their human resources. But we know already they're spending 7% of their annual budgets on employee wellness. So we know that resources are being provided. And actually, they've been welcoming of our solution simply because we take it out of their hands. And that also works for employees as well, because the ownership is completely taken out of HR, and it speaks to stigma and confidentiality, and people know that actually my employer doesn't even need to know that I'm accessing this platform. They just need to know that actually they don't need to know anything, and it's worked well for everyone.
Good. Yeah, I want to ask the same question, but the other way. How does the employees feel about their employers probably maybe getting some of the information about their situation? How do you set up this confidence?
Yeah, so I mean, the answer is that they absolutely wouldn't get that information. So one thing I didn't mention in my presentation is that it's highly encrypted. So our platform, and we've built an MVP, it's been built to the US standard of privacy data, health data. So there's absolutely no way that it's all encrypted, and there's absolutely no way the employer would know. What we do send the employer on every quarter is anonymized clinical data. So it's not even aggregated, or it's just completely anonymous. So the employer needs to know that statistically X number of employees are getting better or getting worse, and I think they deserve to know that. But individually, employees wouldn't know that, wouldn't be discussed.
Have you already some corporates ready to test?
We've been in discussion with a couple of corporates. There's one that's JSE listed that expressed interest, and they want to start a pilot with us in February.
Good. Thank you very much.
Excellent. Thank you so much. Startups, come on down.